we will discuss the key concept of Penumbra, compare the role of CT and MRI, and look at a flow chart of the acute stroke imaging protocol. So the first goal of imaging in stroke is to establish the diagnosis of stroke. So you do a plain CT scan or a diffusion MR and you confirm that it is a stroke and not a stroke mimic. For example, hypoglycemia or a brain tumor sometimes presents, or PML. So the first thing is to establish the diagnosis of stroke, and more important is to rule out hemorrhage, because if there is any hemorrhage in the stroke, that rules out IV thrombolysis because of the increased risk of hemorrhage after IV thrombolysis. The next is to get information about the angiogram, about the vessels using an angiogram, and also whether or not there is a penumbra. That means, is there ischemic tissue which can be salvaged by treatment? In other words, the goals of acute stroke imaging are the 4 Ps. We assess the parenchyma and rule out hemorrhage, assess the blood vessels or the pipes, do a perfusion study to see whether there is any penumbral tissue. So when there is an acute stroke, an artery gets blocked in the brain, and distal to that arterial blockade, you have ischemic tissue. The central zone of that tissue is completely infarcted, and that is what causes the diffusion abnormality. It is called the infarct core. But very often, surrounding it, there is an ischemic zone which is not completely infarcted. This is called the penumbra. The size of the penumbra is inversely proportional to the delay of duration in providing recanalization. That means that if the stroke occurs at 9 o'clock in the morning, there will be a big penumbra at 10, smaller one at 11, smaller one at 12, and the penumbra will disappear at 1 o'clock. So the more the reperfusion therapy is delayed, the penumbra becomes smaller. Most patients have a penumbra. The presence of a penumbra has important implications in selection of appropriate therapy and prediction of eventual clinical outcome. How do you, as a radiologist, give information about whether or not there is a penumbra? If you are doing a CT, you have to do a perfusion CT, and it is seen as the discrepancy between the cerebral blood volume and the cerebral blood flow map.